The purpose of why this residency program was started as a community-based program for the area of Tupelo was to provide that need primary care in the area with physicians. A lot of the smaller communities that were outside did not have physicians, or if they did have physicians, they were retiring with really nobody coming in to fill those slots. And so when you're able to create those spots and have people come and train and they start to learn the specialists and they learn the system, it's a lot easier with those working in with the NMMC clinics and with the hospital systems with the surrounding areas of like Pontotoc and Iuka and West Point. A lot of those areas where people go to the major systems, and then a lot of the smaller clinics like in Houston and other things like that, where some of our graduates have gone even down to Eupora and Ackerman and those areas of where we have clinics in different areas. Part of the residency training involves rotations of seeing patients and also patients with specialists, so they're able to see with cardiology, pulmonology, plus have their own patients they follow in the clinic. And the uniqueness of having a community program like ours is in a small rural area by standards of the national, by the nation type things of that nature. We see more of the ability is when they learn in our area, because we have so many people come through here in Tupelo, they have the experience of like a university. So they can take that experience and have that and grow. And when they go out to a smaller community, they're able to do a lot of things they were doing here. And what they can't take care of, they know they can send to Tupelo to be taken care of here.
Stephen Morgan, grew up in Vardaman, Mississippi. It's about 8 miles from where I'm practicing now in Houston. Went to undergraduate at Ole Miss Medical School, University of Mississippi Medical Center. After graduating there, did residency at Family Medicine Residency Center in Tupelo. Now I'm a family medicine doctor in Houston, Mississippi, where I see all ages, children, adult, men, women, minor surgical complaints in a small town. The Mississippi Rural Physician Scholarship Program was started a joint venture by the Mississippi Academy of Family Physicians and several other professional bodies, Mississippi State Medical Association, I believe, when some of the older docs realized that when they retired, there wasn't a strong enough incoming group of younger doctors doing family medicine. And so they became very worried that when they retired, there'd be nobody to fill their shoes. And talking, they thought the best way to get people to go to small towns would be to get people from small towns. And so the scholarship was created as an incentive.
The family medicine residency program, first off, was a great experience for me. Coming out of medical school and just kind of being thrown into patient care can be hard. The residency program had great faculty, though. I had great classmates in my residency, and they prepared me as far as treating, just a common cold that comes into clinic, to managing patients that are kind of at the end of their disease and trying to work through that. We do a lot of clinic medicine, obviously being family medicine, but our hospital program was great there also. Getting to work with the specialists that now I get to refer patients to is great, and kind of see what workup they expect me to do before I refer them and see what they have to offer. But it was a great group. I really enjoyed the 3 years there. The hard part is some of the people saw me when I was probably 5 years old, and there's no way I could remember their names. So I have the problem where I go to introduce myself, and I think this person probably has known me for forever, and I'm treating them like they're a stranger. But definitely taking care of some of the people I got to go to church with. It's some of my former teachers, classmates. It's good to be back home and to see familiar faces for sure. And I have always felt a need to give back and try to put others before myself. And I think that medicine is a great way to use the abilities and the talents that God gave me to help people out. And I enjoy coming back to my hometown and taking care of the people around here and giving back to them.
I'm Eric Tillotson, family medicine doctor. Originally born in Vicksburg, but grew up in Tupelo, Mississippi area. So small towns are kind of my things, kind of what I'm used to. So the thing about family medicine that I always liked was you still get that kind of full spectrum of disease. So you have younger patients to the very old, and you deal with disease spectrum from a very wide spectrum of disease, and so that always kind of interested me. I kind of like having that relationship with the patient and managing the whole patient rather than just one singular aspect of their health, which is also very important. And specialist care is a lot of what we do is referring to specialists. So I'm very grateful that they're out there. But for me, I really kind of like that kind of overall picture and having that relationship with the patient, and then just kind of being able to be their primary doctor. So
my name is Craig Moffat. I'm a family medicine physician here at Maven Medical Clinic, where I do clinic work. I also do hospital at your poor hospital, and I also do some ER work and nursing home work as well with the Webster County. I had a lot of health issues as a child. I was kind of in and out of the doctor a bunch, had several different surgeries performed. So I had from early on, from the age like 2 or 3, I had a lot of exposure. And I felt I had 2 great pediatricians. Both of them actually still in Tupelo, and one of them with the health system, Dr. Robertson. And they always kind of made me feel better. They knew I was kind of interested in science and stuff, and they always explained things to me. And it just kind of created an early fascination with medicine to me. I remember how calming it was to see them, because I'd be scared by all these tests and everything, and they always made me feel better. I think that combined with me being a little bit of a nerd and always liking math and science as well, and me liking studying, because you have to study to be a doctor. So I think all that kind of led to me wanting to become a physician from an early age. I actually grew up in something called Salem Community, which isn't even really a town. My post office was actually in the next county over, so my address was called Gold, Mississippi, which is actually in Tishomingo County, although I lived in Etowah County. I had to drive about 21 miles to high school. We did have a Piggly Wiggly, a Big Star that was about 10 miles away from me, but definitely grew up in a small area. So after the summer of second year of med school, when I was about to start my clinical training, I went to a conference, family medicine conference, and I just saw all the amazing things that family medicine doctors were doing. I mean, there was a couple of counties in Mississippi where they were delivering babies. Not here, but there were some where they were doing that. They were doing hospital, they were doing ER, and most of these people were in small towns. And I started talking to some CEOs and administrators at small community hospitals, and they were like, look, we'll take a pediatrician, we'll take an IM guy, but if we can just get a family medicine doctor here that do a little bit of everything, that's really what we need, because they have a hard time getting doctors. So if they can get someone that can see a 10-year-old, someone that can see an adult, someone that can go to the nursing home, it's kind of what they were looking for, and kind of seeing what all they were able to do kind of helped me solidify my decision to be a family medicine physician. So
a lot of programs nowadays are in smaller community settings because they do provide a direct source of physicians for that area. Many studies have been done over the years talk about that a lot of times residents will practice within a 50-mile radius of where they do their residency. That's been the case for us a lot of the time, but not always. We've had a lot of people stay within the area, but some will go back to their states where they came from, California, Colorado, and that area.